Good afternoon, everyone. We will get started in just one moment. Good afternoon, everyone. I'm Nirav Shah, the Director of the Maine Center for Disease Control and Prevention, and I'm joined this afternoon by Governor Janet Mills and Commissioner Jean Lambrou from Maine's Department of Health and Human Services. And together, Governor Mills, Commissioner Lambrou, and I are joining you to provide an update on where we stand with respect to COVID-19 across the state of Maine for today, Wednesday, December 23rd, 2020. I'll begin by providing an update on where we stand with respect to the disease and our vaccination efforts, and then turn things over to Governor Mills. And I begin my update on yet another sad note. Just in the past day, Maine CDC has received reports of 8 additional individuals who have passed away with COVID-19. One was a woman in her 80s from Oxford County. Another was a woman in her 70s from Cumberland County. A man in his 90s from Cumberland County, a woman in her 70s from York County, a woman in her 90s from York County, a man in his 60s from York County, a man in his 70s from Androscoggin County, and a man in his 60s from York County. The reports of these 8 individuals who have died come in addition to reports of 10 individuals who were reported to Maine CDC who have died with COVID-19. Just since the last time we spoke with everyone. That amounts to 18 people whose deaths have been reported to Maine CDC or that were linked to COVID-19. Cumulatively, this brings the total number of people who have died of COVID-19 in Maine to 311. I'd like to take a moment to offer our deepest condolences to the families of these 18 individuals, as well as all 311 individuals who have died with COVID-19. During this time of holidays, we mourn their loss and we offer their friends, families, and communities our deepest condolences. Overall, right now in Maine, there are a total of 20,491 cases of COVID-19, an increase of 748 cases. Of those, 17,695 are confirmed cases and 2,796 are probable cases. I'd like to pause here for a moment to talk a bit about this striking increase in new daily cases. A few weeks ago, we talked about a backlog that had started accruing of reports of lab reports that had come into Maine CDC of individuals who had just tested positive for COVID-19. Because the number of lab reports that was coming in were so high and coming in at such a high velocity, Maine CDC was having to make process improvements to try to keep up with, analyze, review, and assign those cases to make sure that we were verifying that the reports were true, not duplicates, et cetera. We have started to put in, since that time, extensive process improvements to work on that concern. We've added a number of new individuals. We've streamlined the approach that we take. We've upgraded our IT system, and we've extended the number of hours, as well as working additional timeframes so that we can do everything we can to keep on top of those cases that are coming in. Those process improvements are starting to show fruit. And so some fraction of the increase in cases that we have seen today of this 748, as well as a fraction of the cases that we've seen in recent days, are partly as a result of the process improvements that we have made to make sure we can keep on top of everything that's coming in. We are trying to estimate right now what percentage of this 748 cases come from the last 24 hours versus the days leading up to that. And I hope to have an answer for that very, very soon. But I want to note that even though this increase in cases of 748 is concerning, and it does represent a true number of cases that have occurred in recent days. It does not represent a striking increase of within a 24-hour period. None of that is, and I say that for a number of reasons. One of which is, and as I will talk about in a moment, some of the other metrics that we use to analyze and think about what is going on with the pandemic in Maine have either been steady or indeed have gotten a little bit better. Our positivity rate, as I'll mention in a moment, has ticked downward. The number of new positive test results that come into Maine CDC has similarly started ticking downward. So the pandemic, even though it is with us and in every corner of the state, does not show signs right now in the recent days or recent week of accelerating in growth. Indeed, if anything, it shows signs of stability and maybe even a bit of contraction. What we are seeing, however, with this increase in new cases is the result of Maine CDC's process improvements to make sure that we are able to stay on top of the new cases. All that being said, even though the numbers may seem discordant, the virus is everywhere around us, and we know that the pandemic, if not in Maine, but around the globe, and certainly within the United States, continues to expand. We remain committed to doing everything we can to make sure we are understanding what's going on across the state and are providing data to help us and everyone else understand that. Turning now to hospitalizations. We hit another milestone of sorts today, a sad milestone today. As of right now, 1,000 people cumulatively have been hospitalized with COVID-19 since we began our work back in March. Just in the past 30 days, 314 people have been hospitalized with COVID-19. Let me put that number in perspective. 1/3 of everyone in Maine who has been hospitalized with COVID-19 since March 12th, 1/3 of those folks have experienced their hospitalization just since November 23rd alone. In the 9 months where Maine CDC has been working on COVID-19, fully 1/3 of all of those who have been hospitalized have occurred just in the past 30 days. Right now in Maine, 187 people are hospitalized. 46 of them are in the critical care unit, and 19 of them are on ventilators. As I mentioned a moment ago, sadly, 311 individuals have passed away with COVID-19, and among all of our cases, 2,309 have been among healthcare workers. Turning a second now to positivity rates and other testing metrics. Right now, statewide, the 7-day PCR positivity rate stands at 4.28%, and the 7-day PCR volume stands at 529 PCR tests for every 100,000. As I mentioned a moment ago, those numbers have been stable and indeed have even started trending downward. With respect to PCR positivity, that's a good sign. And so it helps us get a better sense of where things stand with the pandemic overall. Turning to vaccinations. As of this morning, at least 8,001 individuals have received their first dose of the COVID-19 vaccine. Now, I do have some news to report with respect to vaccination efforts. Yesterday evening, Maine CDC was made aware of an instance of an anaphylactic reaction in an individual, a healthcare provider, who received a dose of the Pfizer vaccine. An anaphylactic reaction is a reaction that occurs in a small number of individuals, but is one that is serious. This reaction occurred at Maine Medical Center in Portland, and again, was in a patient who was being vaccinated, given their status as a healthcare worker. The bottom line here is that the system that we have in place to look out for reactions of this nature and make sure they are properly managed and reported worked exactly as it should have. This individual, shortly after they received their first dose of vaccine, was asked to make sure they were waiting in a designated area where they could be observed for precisely this sort of reaction. About 20 minutes after their vaccination, they started reporting some signs and symptoms of discomfort. When those signs and symptoms became concerning, the individual was given appropriate medical care and medical treatment. The appropriate systems were put into place to both spot that, report it, and manage it. My team and I were made aware, and within minutes, I was on the phone with the Deputy Director of Infectious Diseases at the US CDC to not only report the situation, but also to make sure that we in Maine were doing everything that we needed to do to provide the best care, as well as to alert federal health authorities of this situation. Again, this is a situation that has been recorded and reported in other states since vaccination began. It is unexpected, but not unheard of. Reactions of this sort have and will continue to happen. It's important to note, however, that over 800,000 doses of the first Pfizer vaccine have already been administered across the United States, and reactions of this sort have thankfully been the extreme rarity. Some of what's going on here is that as we have moved through the vaccine phases and a vaccine is now available, all eyes are on the vaccination process. That's not a bad thing. That means that when events of this sort can happen, and they unfortunately have now, we have a system in place to make sure that we are watching out for them so that they can be managed and reported appropriately. The last thing I want to mention before I turn things over to Governor Mills is where things stand with respect to our shorter and even more intermediate and longer term plans with respect to vaccination. In recent days, we at the state, at Maine CDC, at Maine DHHS, have heard from a number of individuals, particularly healthcare providers, who are eagerly and anxiously awaiting the day in which they too can be vaccinated. We know that these healthcare providers are on the front lines and are interacting with and providing care to patients. We need them to stay safe and healthy so that our entire healthcare system can stay safe and healthy. We know that all of them, all of you, everyone in the state is waiting for the date that their number in line for their COVID-19 vaccine is called and that they can start getting vaccinated. But right now, across the state, supply is our principal constraint. The bottom line is that we as a state and as a country don't have the supply that we need. And as a result, there have been some tough decisions. We have right now been focused on vaccinating individuals who work within hospitals, individuals who work in the emergency department, for example, in ICUs and on COVID units. Having started there, we are moving outward in concentric circles, and eventually we'll hopefully, in the near future, start vaccinating other medical providers in outpatient clinics, providers who work in cancer centers, dialysis clinics, even providers who may not have an affiliation with the healthcare system or a hospital. That process will take time, however. We are receiving input right now from different groups to help us answer questions, such as when should those folks be vaccinated? Where should they be vaccinated? And how should they be vaccinated? Those are difficult questions, and we are making sure we are receiving input so that we can answer those questions in the best possible way. What I want all of those providers to know are two things. The first is that though this process will take time, we pledge to make sure that vaccine is available. Right now, it is not a question of if, it is a question of when. The other thing I want folks to know is that this situation changes, and it changes very frequently. And sometimes, for example, as we talked about last week, when we experienced an unanticipated decrease in the numbers that Maine would receive, it sometimes changes in ways that make it even harder for us to plan out into the horizon. These changes will unfortunately continue to happen. And so my other ask of healthcare providers is first, of course, to know that there is a place in mind for you, but at the same time, we ask that you bear with us. We ask that you have the same flexibility that you've shown throughout the pandemic, as well as that same fortitude in continuing to care for patients and continuing to work with us as we plan the best ways for when, where, and how to vaccinate you. There is a place in line, and we are working to get it to you as quickly as possible. So with that, Governor Mills, I will turn things over to you. And Governor, apologies, you are on mute.
Thank you, Dr. Shah. Thank you for your patience and your understanding and your comprehensive answers to so many questions every day. People in Maine, I think, should be confident in getting the vaccine when the CDC recommends that it's your turn in line. And I know that these briefings are a welcome source of information about that critical undertaking. Monday marked the winter solstice in Maine, the shortest day and longest night of the year. Every day that follows, of course, we slowly regain the sunlight until the seasons change. These are also the darkest days of the pandemic in Maine and elsewhere. Just this week, at least 3,239 new coronavirus deaths occurred in the United States. Over 200,000 new cases were reported on December 22nd. There's been an average of 215,000 cases a day, an increase week to week. So we, as Dr. Shah just described, as we work through the backlog in cases and testing, the number of cases will be larger. But the bottom line is we in Maine are still very much in the throes of this virus, as is every state in the country. But we can and we must do better controlling this. We approach this holiday weekend, especially, and the new year, with humility and trepidation. The arrival of a vaccine or several vaccines has brought us desperately needed hope this month, and our first rays of sun signaling a new day far down the road. 8,000 people have received their first dose of vaccine, and we celebrate that fact with everyone. But we must exert the patience of Job right now, while vaccines of various sorts continue to be developed and make their way across the country, week by week, month by month, until everyone can breathe a sigh of relief that the pandemic is ultimately behind us. We're a long ways away. Meanwhile, that deadly virus has hit every county, every corner of the state. Nearly every one of the 426 zip codes in Maine has had documented cases of COVID-19. And until everyone eligible has been vaccinated, we have to keep taking precautions that will keep our communities and our healthcare workers and our hospitals safe. We've just passed the shortest day and longest night of the year, but the light increases ever so slowly. And we don't pretend that the solstice suddenly raises the curtain of sunlight in a heartbeat, just as the arrival of one or two vaccines doesn't cure the pandemic and doesn't put it behind us in a heartbeat. The darkness of this pandemic remains with us unabated. Its cure is a long ways away. Meanwhile, we all, each and every one of us, has a duty to protect each other. You know, there are a lot of things we take for granted in our daily lives. We assume that when we go to the store, a friendly face will greet us behind the counter. We assume if there's a crime in the neighborhood, a police car will show up and help solve the crime. We assume if we get into an accident, or if we get sick, an ambulance may arrive and take us to the local hospital, and that doctors and nurses will be there to tend to us and make us better. We can't have holiday parties and invite all the neighbors over, hug and kiss under the mistletoe, drop our face coverings, sing carols, and eat, drink, and be merry without thinking about all of those people and all of the services and the folks we take for granted. COVID may be your dance partner at the party this year. COVID may dine with you at the holiday table. COVID may be the guest you didn't mean to invite, but chooses to sit next to you and sit next to everyone you love. So before you wonder about being alone on a holiday weekend, before you accidentally head to the store without your mask, before you feel like going over and giving your neighbor a hug, think again. Think about the dozens, perhaps hundreds of other people you may be affecting and infecting quite unintentionally, but just as certainly. We all have choices to make this year, this time of year. We can sit around and feel sorry for ourselves. We can get angry about the loss we feel, perhaps the loss of a loved one, the loss of a normal holiday, perhaps the loss of a job or loss of income. Someone once said, you know, you can't change what has happened to you, but you don't have to let it define you. And what you can control, and sometimes the only thing you can control or change, is how it affects you and how you respond to bad things, how you respond to what happens to you. So we can stand together through this holiday season, a season of waiting. We can refuse to let this virus define us. We can show that we are as courageous and strong and resilient as the people who settled here years ago, the people who were here before us, and the many who've braved many hardships to get here now and then to make this state the fine, beautiful place that it is. We can make our state the safest place to be if we keep working together, if we don't give in to the temptation to break the rules, because COVID doesn't take a holiday. If we avoid giving in to the inclination to ignore what is dangerously obvious, the pandemic is still raging. It's making people sick. It's stealing the lives of people across our state and our nation. So this week and every week, we must find new and creative ways to connect with loved ones, neighbors, and friends. We just have to keep wearing the masks everywhere, watch our distance, wash our hands, and avoid gatherings outside with people outside our bubble or our immediate household. The biggest gift we can give each other this holiday season is not a present under the tree or a hug shared by a loved one. The best gift we can give and the best gift we can receive is the gift of health, the gift of life. You have it in your power, everyone watching and listening, to give that gift and allow everyone to live another day and celebrate safely together next year at this time. And by the way, be sure to give your local small businesses the gift of your support, whether it's picking up a present at the shop on Main Street, curbside, whether it's shopping downtown, buying a gift for your favorite restaurant, a gift card. These businesses all need our help too. A woman named Susan Cooper wrote a poem about the winter solstice, which says in part, "Came people singing, dancing to drive the dark away, this shortest day. As promise wakens in the sleeping land, they caroled, feasted, gave thanks. They dearly loved their friends and hoped for peace. And now so do we here, now, this year and every year. These next few weeks will be tough, even the next few months, but we are Maine strong. We will distribute vaccines as quickly, efficiently, and equitably as possible, but no one should want to be responsible for any super spreader event, and no one wants to have any unfortunate holiday surprises. No one wants to end up in Dr. Shaw's statistics. So we need everyone to continue to wear your mask, watch your distance, wash your hands, avoid gatherings, and together we'll drive the dark away, greet the sun rising on a new and better year. I wish everyone health and happiness in a season that is traditionally marked by waiting, by hope, by kindness, by the arrival of new and welcome life. Let's also remember that even in normal times, holidays can be a difficult time of year for many, and let's do what people in Maine do always. Check on neighbors, help those who are struggling, and extend a hand in kindness. These simple things can make a difference in people's lives. Please keep the faith and stay safe. Thank you.
Thank you, Governor Mills. Before we turn to questions, I'd like to turn things over to Commissioner Lambrou.
Thank you. Today, we are announcing the launch of a new text messaging service to alert Maine people who test positive for COVID-19 of the steps to take to protect their health and limit the spread of the virus. Beginning today, people who test positive for COVID-19 and voluntarily provide their telephone number to their testing site will receive a text message from the Maine Center for Disease Control and Prevention. It will indicate that they should isolate for 10 days at home, inform close contacts of potential exposure to the virus, and stay safe. Recipients will also be directed to find further information at Maine CDC's website. That message will come from Maine CDC at the number 22300. This is just part of our effort to communicate with Maine people about how they can best keep themselves safe and help spread the disease. Thank you.
Thank you, Commissioner. And before I turn to questions, sorry, Dustin, one last update. Since I started talking, I have received an update on the individual who experienced the reaction that I mentioned to the Pfizer vaccine. The individual is doing well. The individual was observed overnight in a hospital setting to make sure that they were okay. The individual is doing fine right now. And from what was told to me, the individual is asking whether they will be able to get their second dose. So whether they are able to is a question for the US CDC, but that was the question that was posed to them. So to us. So with that, Dustin, I'll turn things over to you first.
Thanks, Dr. Shah. The first question is for the governor. Now that there is a stimulus plan from Congress, are you considering more restrictions on businesses at all? Or did the stability and contraction of COVID-19 that Dr. Shah mentioned mean no immediate statewide changes?
Thanks, Dustin. It's something we talk about just about every day. What are we not doing that we could be doing? What other kind of help is there for entities in need, businesses, families, unemployed individuals, healthcare workers? We keep trying to balance these needs and these resources available. That changes day to day. As you could see from last night's news, there is no stimulus package right now. It has not been finally enacted. It has not been signed by the president. I can't predict this president's actions, words, or behaviors. But until that's signed into law, we can't depend on the stimulus package that was negotiated so hard over the weekend in a bipartisan effort. We can't depend on that for resources for business, resources for schools, resources for healthcare institutions, and the like. So, but that isn't the final factor in whether or not we decide to provide further guidance or restrictions in order to control the virus. The most important factor is the public health, and I'm not taking any actions this week. Somebody's got something on mic. I'm not taking any actions this week to further restrict any particular sector of the economy.
My second question, I think, is for Dr. Shah. We're expecting some significant wind over Christmas. Are all the sites where the COVID vaccine needs to be kept cold ready in case of a power outage?
Yes, so Dustin, one of the elements of our planning is always what if. What could happen if something were to happen at this location, at this site? Maybe it's a flood, maybe it's an electricity outage, maybe it's an ice storm that makes travel difficult. We always have contingency plans. In this case, the locations in which that have ultra cold storage, one of the questions we ask is, do you have a backup generator? And the answer is yes.
Perfect, thanks.
I'm going to turn things over to Patty White next.
Thanks, Dr. Shah. So our first 3 weeks of the vaccine allocation gives us close to 65,000 doses. And even though that's lower than expected, that's more than enough to cover the 20,000 or so high-risk hospital employees. And I think independent primary care doctors are wondering why they're not immediately next in line, understanding that this is all very complicated. But can you just explain that a little bit more? I think they want some assurances that they're not going to come behind other, that they come into contact with patients too, and they kind of want to have top priority.
Of course, Patty, and I'm happy to walk through what those numbers look like, because you're right as to the aggregate number, but it's also important to bear in mind that another area of activation for us was the retail pharmacy partnership, the partnership that we have agreed to work with the large commercial chains, Walgreens, CVS, and others. That partnership entails dedicating a certain number of doses to make sure that program can get activated and can get launched. We'll get you the exact number of doses. I'm pulling it up sort of as we speak right now, Patty, to make sure I've got it for you exactly. But the bottom line here is that although we want to make sure that all independent providers, as well as those who are otherwise affiliated with the hospital, say as staff members who are in an outpatient setting, that is affiliated with the hospital. We do want to make sure that we are able to vaccinate them, But in order to do so, we not only have to account for what the supply of the vaccine is, we've got to figure out what the optimum place for them to get vaccinated is. So the Pfizer vaccine, for example, comes in trays of 975 doses. For a small practice, that's a challenge. And so we've got to figure out whether the best thing for small providers to do is to come to a centralized location. For example, we're getting input from different groups of how we can do that in a way that's both fair as well as efficient. No final decisions have been made. And that's sort of where we're at right now. Let me see if I can get you that exact number, Patty, as to the number of doses that we also committed to the first phase of the retail pharmacy piece as well.
And Dr. Shah, while you're doing that, I would just mention that there are these 3 different groups that we are prioritized in the first 3 weeks, and our order will be placed tomorrow for the next round of vaccine. In addition to hospitals, because we want to maintain those critical care services, we also have allocated to our emergency medical service personnel because they are often on the front lines transporting people with COVID-19, and we need that workforce strong. And on the long-term care part, we previously had initiated the Part A skilled nursing facility component, where we've certainly had in the last number of open outbreaks, 1 in 10 have been associated with skilled nursing facilities. With our new order tomorrow, we will get back on track and initiate Part B for assisted living and other group homes. That is important because again, looking at our open outbreaks, fully 1/3 of the open outbreaks today that we have are affiliated with assisted living or group homes. So we do want to, as efficiently and equitably as possible, get to all those concentric circles of our healthcare providers in Maine. We are committed to doing so as soon as possible, but we felt the urgency to start with our critical care providers and people most vulnerable to COVID-19.
Patty, that number that we are allocating toward that partnership, which will again be used to vaccinate residents of skilled nursing, the staff who care for them, as well as the commissioner noted, residents and staff of assisted living and other congregate type settings. That number for just the first 3 weeks is about 19,000 doses.
Okay, sorry to kind of keep asking about this, but I think if some of these physicians outside of hospital networks look at those numbers, if it's about 20,000 high-risk hospital employees and 20,000 people in this pharmacy program, that would still leave about 20,000 doses for some of these other workers. Am I understanding that correctly?
Well, those other workers include EMS clinicians, individuals who work in home health. There are a lot of folks, and there are also within hospitals, even though there may be that highest risk category, ICU staff, emergency department staff, COVID staff, there are others in hospitals that are also essential and need to be vaccinated at the same time. So there are a lot of competing demands. More supply is on the way. So it really is a question of not whether, it's a question of which week. We recognize that independent medical providers are doing extraordinary work caring for patients in their community. And so again, we're making sure that we can vaccinate them in a manner that also makes sure we can vaccinate other members of the healthcare ecosystem too, like EMS clinicians, home health providers, as well as others in the hospitals.
Thank you.
Mm-hmm. I'm going to turn over to Mel Meyer at WGME.
Good afternoon, Dr. Shah. I'm wondering if the CDC is tracking how many cases are linked to small gatherings, and if you're able to release this data and see how that compares to other big contributors of the spread.
Mm-hmm. Mel, I don't have a number for you right now. I can check with our epidemiology team to see what their analysis has been on that. This is, the question here though is, what fraction of new cases are being driven by small gatherings? And we are, again, trying to work with our epidemiologists, and there's a working group at the US CDC that's thinking about this a little bit more quantitatively. Right now, I'll check with them to see what their latest analysis is. We know that it's a sizable fraction. The reason we know that is that when we talk to folks who have been recently diagnosed with COVID, and we call them to say, where have you been in the last 6 or 8 days where you could have been exposed to COVID. One of the things that's changed in the recent 6, 8, 10 weeks as compared to the summer is that back in the summer, what folks reported to us was that they had participated in a large gathering of some sort. That was the predominant finding. Nowadays, what we're finding is fewer and fewer and fewer individuals are reporting any association with any large gathering, save, for example, for family dinner or a gathering at their brother's house or something of that nature. And so it's on that basis that's given rise to the concern around these smaller gatherings. What that exact fraction is, again, is trying to be worked out, but the concern is still there, even though the range or the guardrails around it is still, as of right now, precisely unknown. The concern is very much in front of us.
And then the CDC had put out guidance for things. Sorry, sounds like somebody's dialing in. What advice do you have? I'm sure it's similar to what you gave for the Thanksgiving holiday. What advice do you have for people who are still planning on having a few people over? We know that people are probably going to hear the warnings and might not exactly follow it.
You know, my advice for folks in this regard as we go into a holiday week is, first of all, gatherings are a risk. And I think we should go into this week acknowledging that gatherings of any sort with individuals outside of your immediate household present a risk. My advice to folks is that if a gathering is in your family's cards, first, think about whether you can do it virtually, whether Zoom or FaceTime or any other medium is an acceptable alternative. But if it's not, try to keep the gathering as small as possible. Try to see if the most vulnerable folks in your family really need to be there or whether you can connect with them in another way. Try to see if you can make the gathering as short of a time as possible and wear face coverings. There is no shame in wearing a face covering inside if you are with others, particularly if those others may be vulnerable or who have contact with folks who are vulnerable. I recognize it's a special time of the year. And for many of us who have endured a very difficult year, this week and the time you spend with your family may be the one thing that gets you into 2021. I get that. But there are still ways that you can keep those gatherings as safe as possible, but yet acknowledge they are a risk.
Well, let me add, I know it's really difficult for people, if somebody does come visit your house, to tell them to stay 6 feet away. You might do what many businesses are doing, most of them are doing, because we asked them to do it, and that is to say, to put up a sign, put up a note on the door. If you come in here, please keep your face mask on. Please stay 6 feet away from anybody else in the house. And it's difficult when people have houses that have small spaces, but if people insist on visiting and you insist on having them visit, do those simple things. Don't wait to ask them or tell them or remind them. Put a sign up, put a piece of paper on the door that says, remember, stay 6 feet away from others and wear your mask and wash your hands.
Thanks, Mel. I'm going to turn it over to Allison Ross next.
Hi, Dr. Shah. Thanks so much for taking my question. So back to the vaccine, since both of these vaccines require a second dose, how important is that second dose? Going off of that conversation we had earlier about that healthcare worker who had the allergic reaction, will they have any sort of immunity even if they're only able to get that first dose?
Allison, the answer is that it's not known. In fact, I spoke with the person in charge of infectious diseases at the US CDC last night and then emailed with him this morning. And one of the questions on my mind was this exact question. What about that second dose for this particular individual who had the reaction? And what this individual at US CDC named Dr. Dr. Butler shared with me is that the data around the efficacy, the protective effect of just one dose are not well known. And that's because in the studies, they use 2 doses. So we don't really know. There is a little bit of evidence to suggest there might be a little bit of benefit, but it may not be one that lasts for very long. So when you think about vaccines, we got to ask 2 questions. Is it protecting you, but also for how long? And something that protects you really well, but wanes in a month or 2 isn't really doing any good. So the recommendation from the US CDC for everybody is that both doses are essential. Indeed, their definition of what counts as immunized entails having both doses on board.
Great, thank you.
I'm going to turn things over to Don Kerrigan next.
Good afternoon, Dr. Shah. Thank you very much. And good afternoon, Governor and Commissioner. So I have a question about about vaccine. I believe you said early on that we've had roughly 8,000 doses of the vaccine administered so far in Maine. Is that the correct number?
That is correct, Don. It is at least 8,001 doses. And I say at least because people are getting vaccinated as we speak right now. And that number is as of about 8:30 this morning.
So does that seem like a reasonable number? On the face of it, given how many doses we think we've gotten, it would seem that we've been at this roughly a week, that doesn't seem like a lot. Are we hampered in our ability to get a lot of people vaccinated quickly at this point?
So Don, I think what you got to look at there is what your denominator is. So 8,000 out of what number that were available to us to offer to healthcare providers. Bear in mind that even though we have received a solid number of vaccines in the state, indeed, by the end of this week alone, we will have received 45,650 doses allocated to Maine. But of those 45,000, about 35,000 will be available to healthcare providers to continue getting vaccinated on. Fully about 11,000 of them are going toward the pharmacy partnership. Of that, we know that the pace of vaccinating folks within healthcare systems is getting faster and faster and faster every day. So I'm comfortable with where we are. Indeed, when I was chatting with some colleagues last night about where their states were, they are not anywhere close to having worked through the allocations that they got from just the first week alone. And we in Maine have already utilized that and are now moving on to our second week allocation. Keep in mind that for many clinics and hospitals in Maine, that second week allocation, predominantly comprising over 20,000 doses of Moderna vaccine, just arrived yesterday and today. So we can only vaccinate based on what we've got. And what I've seen in the numbers and in my communications with medical officers at hospitals is that when vaccine comes in, it is unpackaged and put into the production line so healthcare workers can get vaccinated. Sorry, Commissioner, go ahead.
Well, I was just going to say, and in that first week, which was really last week, we had 6,825 vaccines doses that were available for use. The rest were allocated to the nursing home program, which is beginning this week. So I think we're doing quite well.
Yep. So Don, just to put a finer point on that, we've already blown through and utilized those 6,800 doses. That's a great thing. We're now using the doses that we've just received in Maine in the last 36, 48 hours.
And I think you said Monday that you expected yesterday to get the word from the feds on how many doses of Pfizer vaccine Maine could get next week. Is that right?
That is correct. Here's what our allotment to Maine from Operation Warp Speed looks like for next week. For next week, week 3, which begins on 12/28 in the vaccine world, Maine expects to receive roughly 10,725 allotment of doses for the Pfizer vaccine and 8,400 of the Moderna vaccine. But very importantly, of that 10,725, a large fraction of it is going to be utilized for the pharmacy partnership. All in, about 8,000 doses, 8,700 doses of that 10,700 of the Pfizer vaccine will be utilized for residents and staff of long-term care facilities and skilled nursing facilities. It's also important to note, Don, that this is not what we thought we were going to get. We thought we were going to get about 350 doses more than what our actual allotment is. That's yet another reason right now, these supply constraints are one reason we're not able to vaccinate folks at the rate that folks want to be vaccinated.
And one very brief question, if I could have one more. Are you still getting a lot of reports, or I guess any report is too many, of healthcare workers contracting the virus despite all their precautions?
We have received reports of healthcare workers contracting the virus. As of this morning, down 2,309 of our now over 20,400 cases were among healthcare workers. But very importantly, Don, that should not be taken to suggest that they acquired COVID on the job. Some of them may have, but healthcare workers, like everybody else, may be exposed to the virus in their community as they go about their lives on a day-to-day basis. But we also make sure we categorize them appropriately so that we can work with their employer. Sadly, that's one reason healthcare workers so vital to our infrastructure and keeping people healthy. One reason we're making sure we can vaccinate them as quickly as possible.
Thank you.
I'm going to turn things over to Isha next at the BDN.
Thank you, Dr. Shah. I have two questions about something you said at the beginning of the briefing today. So I was wondering if you can tell me what the signs of stability are that you mentioned in terms of the pandemic, and also what the process improvements the CDC is making leading to this influx of new cases.
Sure. So the signs of stability, there are a few that we look at, Isha. The two that I would point to as being the most relevant right now for our discussion are the one we've talked about at length through the pandemic, the positivity rate. The positivity rate in Maine, for example, has actually gone down just in the recent few weeks. Let me provide you some more specific numbers around that. Right now, the positivity rate in Maine for PCR tests stands at 4.28%. On December 1st, for example, so more than a full incubation period ago, it was right at 4.19%. So still within the same ballpark. But within that time period, it has fluctuated. It's gone up to 4.5%. In recent days, it has come down, and we've seen a slight downward trajectory. That's a good thing. And again, shows that over a full incubation period now, we've been basically in the same ballpark. Again, suggestive of stability with respect to transmission. Another metric that we look at is literally just the number of positive daily results that come into us every single day. And we look at the 7-day average there. Right now, the 7-day average of positive PCR results is right at 305. In the period before that, the 7 days before that, it was 370. So we've started seeing a slight decrease. Now there's a lot of variation on a day-to-day basis in those numbers, but those are some of the signs that we look at. And then I'll just make one last observation. We see the same degree of stability when we look at the antigen testing numbers as well. The numbers there are much smaller, so it's harder to draw conclusions, but we see those same signs of stability. What we're not seeing, for example, is a decrement in the positivity rate in PCR that's being made up for on another modality of testing, and that's a good sign. None of that is to undermine the seriousness of the virus one bit. The virus is here, it is still spreading, but where we are at is at a high plateau.
Thank you. Can you elaborate on the process improvements part of this? And also, I'll ask my follow-up now. Should we essentially be seeing even higher case counts per day in recent weeks if CDC is keeping up with these process improvements?
So let me talk about the improvements and then I'll answer your question. We've made improvements along 3 lines. Number one is we brought on more staff. That's critical. We've brought on new individuals to help assign cases, which is to say review the laboratory results and determine where they go from there. And we've brought, I'll get you the exact number, but I believe it is 12 additional individuals, but I'll double check to make sure that I'm recalling that correctly. So we brought on new staff. We've also just made improvements along the way to make sure that there are no extraneous steps in the process of getting a lab result and taking action upon it. So literally process improvements in the process. The third thing is that we've made IT improvements so that these additional staff can be working within our database and not duplicating work, not making sure that they are looking at the same case with 2 people at once, as well as expanding the number of servers that we've got so more and more people can be working in the system. It's not glamorous, but this is the day-to-day work that our informatics teams and our epidemiology teams do to try to keep up with things. To your specific question, it is probable that as we make these improvements and those improvements mature, there will be more and more cases that we are seeing as a result of these improvements. This is what we want to know because we want to make sure we're having data that's accurate and timely so we know what's going on in the pandemic. I'm going to turn things over to Emily Tadlock next.
I'm so glad I'm next because I'm going to kind of follow up on all of this, Dr. Shaw. My question now, I noticed in a press release that the COVID-19 data dashboard is expanding with all of this data. Can you explain how this new data will actually give an accurate representation? I mean, you talked about before there were 740 new cases today, but they weren't all from a 24-hour period. How can we give our viewers an accurate representation of what's happening day to day?
Great, Emily. I'll give you, there are many examples. I'll invite Commissioner Lambrou, who's been very involved in this process as well, to provide any additional gloss, but let me give you a really concrete example, Emily. Right now, the way that when you look on our website and you look at the number of new daily cases, those are, as is noted in the legend, assigned out by, or those are logged by the day on which the case was assigned out for investigation. That's a function of the high number that we get in and when we are able to process it. But really, what matters is not when Maine CDC processed the lab result and assigned it to somebody. What really matters for your viewers is when did that case actually start showing symptoms? Or when did they actually get tested? That's the real piece of information that we should care about because that tells us when people are getting COVID and when they were more infectious. One of the new visualizations that will be front and center on our website is a graphic that shows that answers that question, not when we get the processing done at Maine CDC, but actually when did the person report symptoms and get tested? Because that's what really matters for risk as well as getting a sense of what's going on in the pandemic. That's just one example of the ways that our updated, upgraded, more advanced data analytics will help people get a sense of what's going on.
I'll add that while we are really excited to be able to separate out this question of when cases were assigned versus when those cases were tested, that will be a big advance for our understanding of what's going on. I want to overlay that we care passionately about making sure that Maine people who have tested positive have information. So in addition to the new text system that we're rolling out today, we created 3 weeks ago a case notification system. So if we're not yet able to get to you with a Maine CDC case investigator, we'll have somebody call you, give you information, explain what isolation is, explain what to do next, and most importantly, explain where to go to get more information. So we are committed to not just ensuring that the data that we post are as accurate as possible, but behind the scenes, making sure that we're reaching out to Maine people to make sure that they have the information that they need to protect themselves and their families.
Yeah, my next question was actually on that text system, Commissioner Lambrou. How is this texting system actually going to help? Is it just going to be a text follow-up saying, here's where you can find more information, good luck, or is there more to it than that?
You know, what we know is that oftentimes people get a test result from a doctor or a testing site and want to know more, giving them basic information saying, we know that somebody at this member has a positive test. If so, isolate. If so, contact your close contacts quickly. And again, the point here is quickness, because we know that COVID-19 can spread, especially with people who are asymptomatic. So we want to make sure people have that information as soon as possible. It does link to our site where we have detailed fact sheets on what is isolation and what is quarantine, which will help people. And of course, there's 211 where people can call to get help. So we continue to try to provide all of the above, as much information as possible, so that people diagnosed with COVID-19 know what to do.
Emily, if I may as well, the text messaging is an additional feature. It does not replace or it will not replace other outreach that Maine CDC may do. So if someone is a healthcare worker, or if someone is over the age of 50, we will still reach out to them and do a complete case investigation, because those are folks that we need to be in touch with. The text messaging recognizes that time is of the essence after somebody gets a positive result, and it just initiates it. It's the first step, but it is not the only step for folks who are in the categories that we are investigating.
Thank you.
I'm going to turn things over to Patrick Whittle next.
Thank you very much, and happy holidays to everybody. My gift for everyone is I only have one question. So there's been some chatter among social activists about where residents of Maine's prisons, jails, and detention facilities are going to fall in terms of prioritization for the vaccine. I'm happy to be corrected here, but I don't think that they're incorporated into any of the phases yet, and I would love to know what the plan is for that going forward.
Sure. Oh, Patrick, I'll start. I don't know that there has been any final decision that's been made. It is a difficult one. Right now, because of the supply constraint that we are under, which we've talked about with Patty and Don and others, there is much, much more demand for vaccine in Maine than there is vaccine in Maine. As a result of that, we don't really have visibility from Operation Warp Speed beyond the next 10 days or so, if that, about what the supply coming into Maine will be. For example, we learned about 26 hours ago what we would be getting in Maine on Monday. That's the window that we're operating on, which makes horizon planning of that sort very, very difficult to do. Right now, in addition to that, Patrick, we are laser focused on getting vaccine to healthcare providers, independent medical physicians, or independent medical groups, nursing homes, the folks who live there and those who care for them. That's really what we're focused on right now. So I don't know that there's been any final decision that's been made. And much of that is because we don't really know what the horizon looks like for continued supply.
I see. So it sounds like the decisions about when residents of jails, prisons, and detention facilities will receive the vaccine is kind of subject to the same supply issue that just about every sector of the state is dealing with then at the moment.
I think that's fair. At least that's how I'm thinking about it. It really is a supply concern right now and a supply constraint. Hopefully, at some point in the future, the COVID vaccine will be like other vaccines, where there is a robust supply, like MMW or like MMR and other vaccines. But right now, the supply constraint even makes planning for the future very, very difficult, because we literally don't know beyond the week of December 28th what kind of allocation Maine will receive with respect to vaccine.
I see. I know I said I only have one question, but consider this sort of question 1A. Can someone speak to the importance of immunizing residents of jails, prisons, and detention facilities? Because there have been outbreaks in those facilities since the start of the pandemic, and they're figured to be more.
It's important for every single person in Maine to be vaccinated. Certainly, we are concerned about any individual who lives in a carceral setting, in a congregate setting of that nature, because COVID-19 can and has spread in them. One of the concerns, or one of the approaches to keeping folks in those facilities safe is, for example, to make sure that the routes in which we have seen COVID enter them, namely through the staff at those facilities, corrections officers, jail staff at the county level, making sure they are vaccinated, that doesn't for a second obviate the need to vaccinate the residents of those facilities themselves. Again, it's not a question of if, it's a question of when. And doing that sort of horizon planning for phase 2 and beyond is almost impossible when beyond the week of December 28th, we don't know what Maine's allocation will be. So we absolutely understand the need. We concur with the need. And we know that this puts an immense amount of strain, for example, on the families of those who have residents, or who the family members who have friends and families who have folks who they know who are in these facilities. We recognize the strain that it places on them, but we also have to make sure that we have a sense of what the plan looks like. And in order to do that, we need to know what the supply looks like.
Thank you very much. I appreciate it.
Yep. And the sure thing, Patrick. And the final question of the afternoon today goes to Eric Russell.
Thank you, everybody. I have two questions. I'll start, I think, Dr. Shaw, with the first one. You know, it's easy to Monday morning quarterback all of these decisions about vaccines, but I wonder if you can maybe explain the thought process between putting some essential workers ahead of people in the 65 and over category. You've got maybe a 40-year-old grocery store worker who doesn't have any health problems, or a 30-something-year-old teacher who doesn't have any health problems. You know, they might be feeling like, why am I in line ahead of, you know, people who are 65 and older, particularly if those people might have more dire outcomes if they were to get the virus.
Mm-hmm. So, Eric, first of all, no decisions have been made finally with any finality with respect to phase 1B. We have been reviewing the recommendations from the US CDC's advisory committee that have talked about what should be the composition of phase 1B. And as you note, that composition entails a mixture of frontline workers, those whose by nature of their job puts them in the line of COVID, as well as very vulnerable members of Maine society, like those 75 and up. It's a hybrid. It recognizes two concurrent phenomena, Eric. One is that those folks who are on the front line are often the most exposed to COVID because of the nature of their job. They have jobs where they cannot social distance. They have jobs where they are interacting with strangers every single minute of the day. That puts them at higher risk for numbers of cases. So one consideration that ACIP utilized was just the number of cases. But at the same time, ACIP also recognized that older members of society have borne a disproportionate share of the deaths. The concept underlying the hybrid strategy is to tackle both at once. By working with frontline employees, we hope to minimize the number of cases. And by working to vaccinate those 75 and over, we hope to simultaneously minimize the number of deaths. We think we can do it both at once. There might have to be choices within phase 1B to put certain groups in certain places because we want to recognize local conditions and such, but that's the concept behind it. Does that answer your question, Eric?
I think so, yeah. And then the other question I had, and this is, you've kind of touched on it a little bit, and maybe we've already covered it, but, you know, have you really drilled down on, you know, exactly why we saw that post-Thanksgiving spike, or is it all the things we've already talked about? Is it, you know, there were small gatherings? Is it the virus spreads more in winter because people go inside and the air is drier and all of these things? Is it really just many, many different factors that have contributed to the current spike?
It is, Eric. So let me say two things. I will add another factor, which is one we've talked about today with Emily and Isha and others, which is the process improvements that we've started to make. We started making them way back when. We've accelerated their implementation as we brought on new staff just in the recent days as well. So those process improvements are also part of the story, Eric. So I think then in that point, the question is, of those various causative elements, which one is playing an outsized role? And that's very difficult. I think there are different data. I think given, as with so many complex, multifaceted problems, the answer is that it's a combination of all of those, perhaps playing a different role at different times. So maybe on days 10 through 14 after Thanksgiving, much of what may have been driving that for those 4 or 5 days was the Thanksgiving holiday. But on other days, it may have been a function of process improvements. And on throughout all of that, omnipresent are things like weather conditions, keeping more folks inside. So it's very difficult when you have multiple causative elements at once to tease out which is playing what percentage of a role.
Thank you, Dr. Shaw.
Governor, that was Eric's question was the last one for the afternoon. So I'll turn things back over to you.
Thank you, Dr. Shaw, and thank you, Commissioner Lambrou, and thank you to members of the media for asking questions. We hope you got your answers. There's nothing simple about any of this. You know, people keep talking about essential versus non-essential workers. To me, every person in the state of Maine is essential. This is not the same kind of analysis we sort of did last spring when the federal government and others talked about essential work that needs to be done and continued despite the stay-at-home requirements and stay safe requirements. It's a different kind of analysis, and we're doing this as scientifically and expeditiously as we can, making decisions with, again, the limited number of doses available to us from week to week, month to month. And it was a question I asked on the White House call the other day. What can we expect over the long term? What can we expect in February, March, April? And those situations, those goals and expectations are developing as we speak. So we're hoping to have better, more accurate answers, more comprehensive answers as things progress. It's just not possible to do it, to identify specific people and specific groups who will be some priority or another in the vaccine categories. But now I'm hoping to get away and go deliver some presents to the doorsteps and driveways of some of my family without physically interacting with them, but preparing for a fairly small holiday weekend, and looking forward to connecting with a lot of people by telephone and by Zoom as we are today. And please, everybody out there, stay safe, keep the faith, stay healthy, save lives. And to Dr. Shah and Commissioner Lambrou, two people who I believe represent the epitome of public service, what is good about people in public service and what good can come of folks serving in the public arena. And I want to thank them both personally and wish them each happy holidays to themselves, them and their families. Thank you so much.
Thank you, Governor. And thank you all for your time this afternoon. We'll talk again soon.